Hello, good evening, everyone. Hi, my chief,
Hello,
boss man. Hello, good evening, everyone.
how about you?
Hi, okay, good evening. Good to have you here. Thank you for joining. And we have other guests around already. Thank you, everyone, for joining our live session tonight. Thank you, Dr. Bravoin. Happy to have you around. Some other persons. All right. Dr. Promise, I'm really happy to have you here today. Thank you for honoring our invitation.
You have succeeded in breaking me out for the first time on live session.
Amen. Yes.
So
Thank
I think you
you.
should add that as a first person to make me be on live video, which I
Yeah,
try to
of
avoid as much
course.
as possible.
Guinness Book of Record ticked. Thank you very much. I really appreciate it. I do not take this for granted. I'm grateful. Okay, so thank you everyone that's joined our live session tonight. Briefly, I'll be introducing us to Dr. Promise Monday, um, one great person I've met recently. Met him 2 years ago when I recently joined my current place of work. He's a wonderful person. He's a great pediatrician, and he has a very good record going back to Benin UBTH, where he graduated from, did his residency training, became a consultant, a fellow of the West Africa College of Physician Pediatrics, and then went off to DIF Medical Center in Abuja, where he practiced as a consultant pediatrician before he relocated to the UK. And currently he's in the UK working as a pediatrician with one of our reputable NHS trusts where I work as well and where I met him. Thank you very much, Dr. Promise, for joining our live session.
Well, you're doing a great job. What you're doing is noble and commendable. So I think that's actually why you managed to force me out.
Yes, I feel we need to educate a lot of parents, as many parents as possible, looking at how ignorance has affected a lot of children out there, especially in our home country. I feel we need to enlighten parents, educate them, and let them know things, basic things they need to do to help their children stay healthy and stay alive.
Well done.
Yeah. All right. Thank you very much. And something you said that you are most passionate about when we spoke yesterday that I added to your bio. You said you do not want to see children die. There's the way you said it. It's it was quite touching.
I
Um,
didn't know you actually noticed it because I just said it in passing.
mm,
There is actually something that featured prominently on my LinkedIn, and it's something I'm very passionate about. Every day I ask myself, why am I a pediatrician? And is the fact that I imagine the pain of the loss of a child, and that no mother should go through that, no father should go through that. And
that
for me,
pain.
yeah, so for me, and that is where I stand in the gap. What can we do to allow children to stay not just alive, but healthy all round development to achieve that full potential.
Good. Yeah, and that's what we're doing here, to have healthy children, to help parents keep their children and help make their children stay alive.
Yeah, this is something brave. Well done.
Thank you. Okay, so briefly, without wasting much time, we'll go straight to why we're here today to talk more on child's health, to ensure our children are healthy and are staying alive. So, our first question for you is to tell us what health really means. Does it mean absence of sickness, or there are other things that we need to look out for to define health for our children?
Well, when we talk about health, even definitions, WHO and all that has also established that you're looking at the whole package of a child. A child is not just made up of a physical body. His child is made up of the body, the mind, and the emotions and everything that that child is made up of, of course, as Christians say, also made up of the spirit. So when you look at a child is not just that the child is absent of disease. You are looking at, is this child growing well? Is he sleeping well? Is he learning and playing? A child who is supposed to be playing no longer playing, it's a problem because children are meant to play. We have child playing. There are things we used to play as children, and then probably as we get older, we start doing those because of life issues. So part of the things that makes a child is that that child plays and is coping emotionally. There's no neglect, and like I always say, I don't know if you heard of the first 1,000 days of life, which is a critical window for brain.
Yeah.
Yes, talking about the first 9 months of pregnancy, which is 270 days, the other first 1 year, which is 365 days, and of course the second 1 year, which is 365 days, making up 1,000 days of life, is a window that if you miss it, you miss it forever. Any child that missed that forever, because that's the point where the brain grows to the fullest. Most of brain growth occur before the first 2 years, and if that window is missed, that child has missed it. So a child may not be what may look physically healthy, but that child has missed that window of critical brain development.
Beautiful. Thank you very much for that enlightening answer. Okay, I'll ask another question, but this time around is on nutrition. What are the most common nutrition mistakes parents make with their children? Because we know nutrition has a lot to do with the brain development, has a lot to do with the child's health. So, what are the common mistakes parents make with their child's nutrition?
Um, I think commonly there are many things, but because of one of the time, I'll probably highlight a few things like eating a lot of sugary products, sugary drinks, fizzy juice and all of that. Of course, in itself is not a problem, but we're talking about excess, taking much of those things. And that is because some of these products are refined, so they don't go through the normal slow process of digestion. So the child, it goes into the child's body, so more like a rush. And there's increased energy spike, so the child becomes very hyperactive. Then the body begin to struggle to convert that glucose into fat, and so over time the child begins to accumulate fat and it becomes obese, which is one of the fastest killer disease in the developed world today. Of course, eventually those things can lead to other secondary disease like diabetes and so on. We could trace the how this thing work, but because of this is not a teaching class. So that's that. Even the brain do not only require sugar, it requires protein, and all of that vitamins. So giving much of this means the child may not have opportunity to take every other good nutrients, and that itself is a problem for child development. Constant snacking means that the child is not able to eat. We say grazing throughout, not able to eat the proper diet, healthy diet, and that itself is a problem. Meaning that child end up not having a healthy diet. Of course, things like forcing a child to feed. When you do that, you are associating feeding with stress, feeding with punishment. And over time, anytime the child sees food, it becomes a child is anxious. Is because you probably done a lot of things to make that child eat the last time, and that becomes a problem. Of course, the other thing which is common, we most parents do that. I think we do that a lot. You bribe or reward children, just to make them do something. Okay, if you eat this one, if you eat I will give you sweet. So over time, the child sees the vegetable as a problem, and a sweet, or whatever, or chocolate is not a good thing. So um, these things, one of habit is not a problem, but when it becomes chronic thing, then that itself have long-term effect, on the child. When we talk about food, we're talking about adequate diet and balanced diet. It's about balance and adequate diet, okay? Not just in quantity, we're talking about the quality, of food. Sometimes people think that a lot of carbohydrates or a lot of, fat, a lot of gas and all of that, means that they're ready, but actually you're not exposing that child to all that the child requires for development. So when you have low protein, low fruit and vegetable in diet, these are common mistakes that that could have. Of course, we talked about forcing the child to eat. That also could be associated as probably stressful meal times. So anything that means the meal time stressful itself is a problem, for the child.
Thank you very much, consultant. Okay, so you mentioned fizzy drinks, different juice. Can you just spell out what you mean by fizzy drinks? Let our parents understand what you're talking about. Like, are you talking about Coke, Fanta? You know, just spell it out and tell them how much their children, or advise them on how much you think will be enough to give their children per time.
Well, the thing is, I'm not an expert in terms of example, but we have many of them around. Things like Fanta, the government on the depend on where you are, Sprite and all of that. So these are drinks that they are sort of refined. They have refined products, and so it doesn't go through the normal slow dietary digestion and absorption for these children.
Mm.
Um, so this is not to label or to because again these are companies that have
Yeah.
children and they're making money. So what we're just saying is excess of
Yeah,
this
for
not good.
sure.
Yes, it's not good for the child because you expose the child to it, is not digested, is so child is having to do with a lot of energy, and that's why they become very hyperactive when they do that, and suddenly there's mood swing, because energy is high, it spikes so fast, and it doesn't stay there, it just crashes, later they're hungry.
Mhm.
uh, it becomes like a chaotic environment for the child, and this itself is not healthy for child development.
Okay, thank you very much. Thank you. If you are there listening to us and you have questions, kindly drop in the chat session. Consultant pediatrician is here to help us answer our questions and lay our fears to rest. Okay, so another thing I'm going to ask from what you said about children who are very fussy and you have to force them to eat. You know, it can be very frustrating. You have a child and you see that child is not gaining weight. This child is just obviously refusing food, and you do not know what to do. You're running out of options here. What will you do in that instance as a parent? It's
Um, but I think you've maybe you mentioned two things together. Are you referring to children who are picky eaters, or a child who, because if a child is getting to the point where they're not gaining weight, it's a red flag, all
yeah,
right? So that itself, you need to seek medical help. You
yeah,
need, to ask for help. In this case, your family physician or GP, wherever you are, what is called in the world.
yeah.
But if you're talking about children refusing to eat, maybe sort of picky eaters, all right. The first thing I want to say is it could be very frustrating for parents, but these are relatively common things among children, especially between 1 to 5 years, and that's because at that age they are trying to establish their control, and their authority. They are learning to, so they know that. One way to say, to probably lay their complaint or grievances or try to be in control is to refuse to eat. And they probably seen that anytime they refuse to eat, there's so much attention. The mother wants to do all of that, So that's one thing that may may lead to that. The other things I think, if parents confuse a child who is an infant to a child who is 2 years old, they're not going to be the same. Remember, when you give birth to a baby, they breastfeed all around, like 12 times a day. So they eat 12 times a day. But you and I, as adults, I think sometimes I eat like twice a day or sometimes once a day, you know. So along the way, the feeding, ration reduces, and that's because for the first 1 year of life, there's rapid growth, brain development and physical development, and so they need all the energy. So now they've done a lot of catch up, they are slowing down. They're not going to eat as much as they used to eat. So we need to know that. So parents are always trying to compare. Where when my child was 9 months old, he used to eat as much. So that's not it. Okay. Now,
Okay.
children, we have to be careful because they need to follow their hunger cue, natural cue, in terms of when they're hungry, they will eat. If they're
Mhm.
not hungry, let them be. Okay. Give them, maybe things to do, maybe in terms of encouraging parents to help these children is one, is to introduce them to let them eat, have a meal time. Because if it's not time, let it be a time a particular time for feeding, for lunch, and a snack. Let it be regularized, and so they know when to eat.
Mm-hmm.
And so that's one thing. And of course, try not to do grazing, in between me, because if they've done that, they're not going to eat. The other thing to do is that why they also become picky, because there's something new. And so you are trying to introduce new food to them. So at that point in time, it is very adventurous to begin to eat something they've not seen before. So
Mm-hmm.
it could be a problem. So you can introduce something they're familiar with,
Mm-hmm.
uh, what they're not familiar with, alone. And if they don't try it, no problem. And now they try it. Usually it says that it take about 10 to 15 times, for you to introduce such meal,
Mm-hmm.
before children begin to get used to that. The other thing to look at is the fact that avoid pressure, like short order cooking, avoid things like promises. If you do this, I'm going to do that for you. Don't do all of that, because what you are doing is you are reinforcing that behavior. The more you do that, the more they do not want to eat.
Mm-hmm.
That. Okay. Now, having said this, there's a caveat.
Mm-hmm.
If your child is getting to a point where they are losing weight, they are vomiting, and they're in pains, so there are organic concerns or medical concerns, or most likely medical concerns to this. This is when you need to seek help. All right. But if your child is gaining weight, is having regular weight, passing urine, depending on the age, is not losing weight, and but is eating maybe 3 times a day like every other adult, then there's no cause for alarm.
Thank you. Thank you very much. Please, if you have questions, just drop in the comment section. Thank you. Okay, there's this question about supplementation. Is just giving them the food enough, maybe putting in vegetables and every other thing enough? Or do they need that extra supplement? Do they need extra multivitamins? Do they need that Abidec? Do they need that extra calcium? Do they need that extra magnesium? If they do, for how long are you supposed to give a child this multivitamin or extra supplements for?
Children, what they need is food, not pills. Okay. Yeah. So that's what they need. Um, as long as they are eating adequate and balanced diet, they do not need extra supplement. But having said that, there are situations where children have medical conditions where they need to be on supplements, right? For children who are born premature, they may not have enough calcium transferred, during pregnancy, especially if they are born before 30 weeks, 2 weeks, 32 weeks gestation. And that is a window when calcium is transferred from the mother to baby. So they sort of have, bone, low minerals, so in this case they will need some supplements, but these often come from the medical team, the pediatrician, or whoever is managing this type. So these are medical prescriptions, all right? um Other things, like if you live in a country where there's low sun, exposure to sun rays and all of that, maybe in the United Kingdom, you might want to give things supplement like vitamin D. So these are supplements. So to answer a question in short, there is no need for extra supplement as long as the child is eating well, is growing, is playing, and is having adequate sleep, except medically indicated.
Thank you very much. Thank you. There's a question in the chat box from Dr. Iguavine. You mind looking at it at a
I
promise?
can't
Can you see it?
see a chat box, so
Okay.
if you can read it.
I'll read the question. I just need to go closer to my phone. So there's a lot of theories, especially online among parents, that there's a rise and strong link between autism and vaccines given to children, especially MMR, that's mumps, measles, and rubella. As specialists and experts in this field, please, what are your thoughts and best advice to layman parents? So thank you, Dr. Egwavo. We're going down to immunization, but um, do we address this now, Dr. Promise, or should we wait till we get to when we start discussing immunization?
And it depends on you. Whatever you want to do.
As the moderator, right?
Yeah.
Okay, I think we are almost in immunizations anyway. So there are some myths, some misconceptions about immunizations, and this is one of them. People do not want immunization again because they feel it will make their children have autism, it will make their children have ADHD. What do you think about that?
Are you referring to that party? Are you talking about immunization in general or autism
I
or?
think he's talking about this particular vaccine, especially. I think he's talking about immunization in general, but especially MMR because that's the most implicated word they are saying talking about.
Okay, so I think that came up. That started from somewhere. An author actually published a paper that tried to link autism to vaccine, and so I bet that has been disproved over time. What we need to understand in the chain of evidence, there are pyramids, in the chain of evidence, and yes, of course, one single paper, they are at the lower chain, but as you go up in that pyramid, we will have things like what we call systematic review and meta-analysis, where that's a big one. What it means that you are pulling different studies together. It could be 1,500 studies, and you then compare all of that, looking at the limitations to study, the sample sizes and all of that. Because sometimes one study could just find something by chance, and then you can't use that, as a conclusion to change practice, because if you're going to change practice, there should be enough evidence to do that. Okay. So in summary, that itself has been disproved. Are there side effects to vaccine or medications? Everything has side effect. Even water has side effect. I was taught, in medical school. So, but you're looking at in terms of benefit and risk, weighing benefit and risk. So when you weigh that, the benefit of vaccines far outweighs the risk of vaccines.
Thank you very much. That's very intelligent. Thank you. If you have question, please drop it. Dr. Ayagweva, we appreciate your question. I will want more of these questions during this live session. Thank you. So we've entered immunization officially, so we have to talk more on immunization. Okay. Do you think immunization is important? Because you're already saying benefits, risks. What are the benefits of immunization? Why should parents go through the stress of taking their children somewhere, see them get injected, see them scream after at the end of the day they start having swollen limbs? Why should they go through this stress? How important is immunization in today's world?
We cannot overemphasize that. It's very important. As a father,
Wait, sorry, before you continue this conversation,
yes.
I know you're already speaking on this rep. Remember, we're talking to lame parents, parents who are not medically inclined. So we have to use basic languages, simple languages that they will understand.
Okay, well, yeah. So yes. So like I said, it's
Yeah.
important. Immunization is important. If you look at history over time, there's been plagues, that happened in the past, and millions of lives lost, to such plagues. And things like smallpox, cholera used to wipe out villages, and until we began to discover in terms of, preventions, and of course vaccines introduced like smallpox, and that led to the end of that. Penicillin, syphilis used to be a very deadly disease.
Uh,
We introduced antibiotics and some of vaccines, and of course we'll talk about chest infection itself. Like what we used to big grammar pneumonia. So there are a lot of things today which help to prevent against that. Places like in Nigeria and some other countries, chest infection, malaria, diarrhea is still a common cause of death. But with the use of vaccines, they are now, they are sort of reduced. Now, if I'm going to talk to a parent who is refusing vaccine, how would I do that? Or if you are listening to me, one thing is you do not come from a place of trying to more like lay blames. All right. So because what the parent is doing is to protect the child. Okay. I can see that is a caring mother, is a caring father, and you don't want any harm to come to your child, and that sort of helped me to put things in perspective, because that sort of lowered the guard. But think about vaccine like this. What's important is like holding an umbrella. So when you have one umbrella, you protect yourself from rain. Now, if every other person holds umbrella, everyone can keep each other, dry. And so when your child is given a vaccine, you not only protect your child from serious sickness from such diseases, you're also protecting other people. Okay?
Beautiful.
and other people are protecting like newborn babies who are born and they are not old enough to be able to be given vaccines. There are some children who have maybe cancer, called malignancy, have cancer. They have they are not able to fight infection because cancer also reduces their ability to fight infection. Elderly people who, as you get older, your immunity reduces. As you're young, your immunity is low. As you get older, immunity builds up. But when you now get old in terms of elderly, your immunity reduces. And of course, there are some other people who have some disease conditions where they cannot have their immunity is low. When we talk about immunity, we're talking about their ability to fight infection. So when you give your child a vaccine, you are protecting them too. All right. So you're not just protecting from the disease, you're also protecting other people from from that disease. All right. So some people cannot protect themselves, so they depend on others to do that. If a fire is starting in one place, it can spread.
Yeah.
So vaccine can help to stop that fire. All right. So if you're not vaccinated, then you catch the disease and then you move to the other person. So some people, parents will say, "Oh, my child is well, my child is healthy." Yes, the fact that we are not saying the fact that your child is healthy doesn't mean cannot catch the disease. Even vaccination can catch the disease, but it reduces the risk at which that disease will either make them to have serious sickness or cause them to die. All right. So that is something that is very important. And even children who are well are able to transfer those diseases to other people. Someone used to call typhoid Mary. I don't know if
Yeah.
was this woman who used to cook food.
Food.
Yeah, used to cook food in Nigerian farm. Say Mama put also cook.
Yeah.
So he kept transferring. People who were eating from that place, kept having cholera, until they found out that she actually had cholera, her gallbladder. And so anytime she watches or coughs or noises, so she transfers her into the food, food. And of course, when that was identified, she was removed that or treated, and of course that stopped. So what I'm trying to use that to explain is that she looked very healthy, yet she was transferring disease to other people. So
Send people that were buying food. Yeah.
yeah, vaccine is important. Now we cannot say there are small side effects, like fever, more like you talk about swollen leg. All of those things are not something serious that will make us not to have vaccine. They are more like you are balancing risk, benefit and risk. So it's yes, you are looking at the fact that the vaccine has much more benefit compared to the risk. There are occasionally very few side effects. They are very rare. Maybe one in 200,000 or one in 20,000. Those are very rare, side effects. And that itself is not enough, to prevent a child from having the benefit of vaccine.
Thank you. Thank you very much for that brilliant response. Thank you. So, the next question is, we've seen situations whereby parents give their children antibiotics. They do that a lot. Self-medication. And sometimes they also want doctors to give the antibiotics. And if you're not giving, you're not a good doctor. Especially in Nigeria, if you have a private hospital and you're not prescribing antibiotics for all your patients, that doctor don't know what they do. If you go there, if they sick, you go say, no worry now, virus, go house. So what will you say about doctors refusing antibiotics, parents wanting antibiotics, getting it over the counter, parents wanting injections? That's another thing we've seen about our populations over there. If you come to the hospital, you've not gotten injection, they feel you do not know what you're doing. So they come to clinic and say, oh, my child has my child is, and they're expecting you to give injections, and you've not given injection, they are not happy. So what do you have to say about the situation? And what do you have for our people out there that keep medicating themselves with antibiotics, even when it is not necessary?
Mm. So when we look at issues like this, it's more of orientation, communication, either from the government agencies or who are in charge of, health, educating the people, the public, and also communication between whether the doctor to the parents, who have brought in the children to understand what is happening. As doctors, we cannot overemphasize the importance of communication. All right. And of course, you too, as parents, you have the right to ask questions. All right. In fact, I have to be a point. Point where parents say you have said enough. So I want to be done to do that. So I keep doing that when I talk to my parents. I say, in fact, sometimes I say it like 3 4 times, and I ask, do you understand what I've said so far? Do you want to say it back to me, to understand? All right. So having said that, communication is important, because if a doctor says he's not going to give you antibiotics, it therefore means that this particular problem does not need antibiotics. And it's important because if your child does not need antibiotics, there's no point giving antibiotics. And that is because of the fear of resistance, okay, to the antibiotics. Look, just for your child resisting, having resistance to those antibiotics. And of course, generally, the creating antibiotics resistant. Now, if you don't know, it takes average of 20 to 40 years to develop new antibiotics. Why every second a particular bug is changing pattern, changing shape, developing new strength, to fight against infections. Like when you have enemy, you are just, okay, this is how the enemy fights. Okay, when they come, I'm going to put my shield like this to protect. So that's the same way, bugs, you want to talk about like bacteria, virus, that's the same way, develop immunity against resistance. Now, so I'm very, it's very important. In UK where I live, UK treats antibiotics resistant like they treat terrorism. So that's how serious it is, because the cost of antibiotic resistant treatment is so high, that it could take everybody out of labor market. All right, and if you have antibiotic resistant, it leads to longer hospital stay, longer cost of a treatment, because we then have to use a more costly antibiotics for you, or rare antibiotics to treat that treatment. The infection or the bug that's supposed to probably last for 2 days end up taking forever to get hit because of antibiotic resistance. It's not just antibiotics, even anti-malaria. We have such issue that chloroquine is actually the wonder treatment for malaria to date, according to WHO. Now, it has to be taken out of shelf, taken out of circulation, probably to be used in another 40 years or 30 years, depending when our generation has gone and the new generation do not have resistance to chloroquine. And it is because of the problem of resistance. All right. So if your child do not need antibiotics, it means your child doesn't need it, and the doctor should communicate that very well to you. Because if you are giving your child antibiotics when the child does not need it, it can lead to resistance. 1, 2, it damages the there are bugs in the tummy. There are good bugs, there are bad bugs. So if you are taking too much antibiotics, it kills the good one, and the bad ones will now have opportunity to move around and cause more problem like diarrhea and other disease for that child. So everything is working in the best interest of your child, as long as your child doesn't need antibiotics. Okay, if your child needs antibiotics and you are not being given antibiotics, then you can seek second opinion, somewhere else, so that they can properly assess your child and decide whether your child needs it or not.
Thank you very much for that brilliant response. So I just want to reemphasize this thing, because I've seen a lot of people, a lot of parents give antibiotics to their children because their children simply have cough. Or I think 2 days ago, someone sent me a message, just sent me a picture of her son's face. It's very obvious that it was mumps. And then she had already bought third generation cephalosporin. So she has bought is it cefalezine or cefurozime? It's big, this high antibiotics that she wanted. She has already started it before she reached out to me. And we have seen a lot of people, their child has fever, and the next thing they've got to buy antibiotics. Please, we are emphasizing this. If your doctor does not prescribe antibiotics for your child, don't give it. If you give antibiotics when your child does not need it, your child might come down with what is called resistance. Resistance is your child's the bug is there, but the bug does not want to go down with the antibiotics. The bug is now forming big man, and the antibiotics is trying to fight the bug, but the bug is not going away. So what usually the antibiotics should have been able to take care of, it will not be able to take care of it, because the body itself has developed resistance to that particular antibiotics. So when your child has serious infection that antibiotics should sort out, it will not sort it out because there's resistance. And we've seen how resistance kills, like Dr. Promise has emphasized, like it kills. We've seen people die because you are giving them every type of antibiotics that you can give them, the highest form of antibiotics, and it's not working, and they keep going down, they keep deteriorating till they die. We've seen so many cases end up in ICU because of infection that probably started as urinary tract infection, chest infection, but they are not responding to any antibiotics and they end up deteriorating and dying. So please protect your children. If your children do not need antibiotics, don't give. Speak to a doctor before you go ahead to give any antibiotics. Thank you very much, Dr. Promise,
You're welcome.
for that answer. And I'm glad we have this opportunity to speak. And then there's one typhoid. You see parents giving antibiotics for typhoid for all for if any sickness is typhoid. We've gone to do wider. We do wider in lab, and the wider have said my child has typhoid. You know, it's very very common in our setting, and they are giving antibiotics. So it's something that we need to get rid of as much as possible. Okay, so the next question is on lifestyle. How does lifestyle, sleep, screen time? I think this is a lot, so let me just take it one after the other. How does lifestyle, sleep, screen time affect our children?
Okay. I think that's all they do at that point, because they do not pay bills and and go to school. And the three of them are actually important, of course, apart from food, which is not mentioned that we talked about food. So talking about sleep, screen time, and of course, when we talk about screen time, we're talking about less screen time. So we need to qualify it. And last time, in terms of activities, they see them like a three-legged stool. So three-legged stool, like if one is affected, the other two will fall. All right. Um, for example, sleeping is not just a time for rest. All right. Parents need to understand that during sleep, that is when the brain is being repaired. All right. So it is when the brain begins to store memories, information things that happen during the day. It is a time where the growth hormone begins, release. Growth hormone has chemicals in the body that helps the baby, the child to grow. And so if they are short, they become stunted. So your child will be wondering, why are my friends very tall and I'm very short? All right. And that's because they have less of that growth hormone. And one of the things that can help with that is sleep. Right. And even the body itself is being repaired at that time. And a child who has slept well is able to cope well in school, is able to learn, have a long-term memory. But if that child is deprived of sleep, they are confused, they are angry, anxious, and unable to concentrate either in school or at home. All right. So you see how one is leading to the other. So the other one is activities. Now that's important, playing around. When they play, it's helping them to develop their muscles, their physical development. And when they play, then they sleep well. And that's why if you notice, your children tend to play, they sleep better when they
When play.
or when they play during the day. All right. So that itself is important. Of course, as long as you're not getting themselves injured, you're there to protect, and supervise those play. Children are meant to play because that's what they need to do at that point. That's play that if you are doing that at the age of 35 or 40, then we say, right, there's a problem, but we expect that a child should behave like a child, right?
Yeah.
Yes. So the other thing is the screen time. Now we're not saying don't give yourself screen, but we're saying limit it, right? And that's because when they have screen time, it's eats into their sleeping time, it eats into their playing time, it eats into their coordination and playing with other maybe parents or siblings, cuddling, hugging, pecking, all of that, which are the things that help to stimulate the child brain development and emotional development. So that eats into. So if the child is spending all the time alone doing that and not having time to sleep or to play or to meet with the family, then it means that there's a lot of screen time. WHO generally recommends that, of course, less than 3 years, limit to one hour. All right. I guess if we all get your feet. Sometimes you are very busy at home, and then your child is talking, and it's just
You
okay.
don't just want that distraction, please.
Just so so I'm not going to come here. I'm not going to come here to say that
Yeah,
that I'm 100% perfect with that. I think
of
my
course.
my wife is even better at even though I'm better at that because I have so much to do, and yeah, this man coming to me to want to do that palliative, and I'm like, I need to meet this deadline to take this. But having said that, we should limit our children, from screen time, and that's because when they do that, they're exposed to the blue color from the screen. That also affect their sleep. So even when they go to sleep, they do not sleep early because of the brain, the effect on the brain. All right. So it
Mhm.
becomes a circle. So they don't sleep well, they are angry during the day, they're unable to play, they're unable to learn, and then that also affects their playtime, it ends up affecting their sleep time, then it becomes a circle itself. So in summary, children need the three, especially sleep, activities. In fact, they should actually spend more time playing, right? Calling, asking questions, talking to them, spend more time doing those things. And of course, screen, because sometimes they also stimulate their brain in terms of different colors also help, to stimulate brain development. But that itself should be very, very minimal.
Thank you.
Mm.
Thank you very much. So, if you are here listening to us, I can see so many people on the chats. Jennifer, thank you for joining. Robert Clinton, kindness, thank you very much for joining. Martin Bolaji, thank you very much for joining. Wary, we can see you. Thank you. Thank you, Faith. Thank you, everyone, for joining. If you have question, please just drop it in the chat box, and we'll do well to answer your question. Okay. The next question: what simple lifestyle habits can parents start today that can make a difference?
You mean for children now?
Mm-hmm.
Um, one is trying to replace screen time with family time,
Yeah.
right? Try to play with them. A few days ago, I think that was 3 days ago. Sorry, I try not to talk much about it, but, I was actually trying to meet the deadline, trying to do something. And here is my boy at 10 p.m. because he slept no longer. So he was like wanting me to start solving puzzle with him. Very difficult one. So I had to drop what I was doing to begin to solve that puzzle with him. We spent an hour trying to solve it. It was very complex. But now I could say I have a lot more to do, but I knew that that is important. You know, 10 years from now or 5 years from now, is probably not going to bother me. He will probably not have my time. So he needs that. He needs to know that. I have a hero in my life. I have someone who can play with me. Sometimes he comes to me and say, "Daddy, can you play with me?" So so that's important. Of course, sleep, have a regular sleep, time. If they need to go to sleep by 8, they should go to sleep by 8 or 10 p.m. Whatever time that you set for them, at least earlier, the better. Of course, healthy eating diet, regularize eating timetable, snack time and all of that. Of course, avoid grazing in between. Grazing means like you see this, you chop, you eat this, you eat this one, you eat this one, chocolate and all of that in between. And that also makes the child to become a picky eater or not able to have enough time to eat take the healthy diet. Okay. So that's important. Children also need that emotional development. We talk about play. They need to know that they are loved. Say to them, encourage healthy behavior, praise them much more than you criticize them. So he said that you have to praise 3 times compared to criticism one time. You don't even need that criticism if it's not really necessary. All right. So as long as you do that, all of this put together will help a child to develop. Of course, they also need to teach them how to read and write, and this also sort of create a memory for these children.
Thank you very much. Thank you. And what science? Now, this question. You have a child, you all are happy, they are playing, and then suddenly you feel they are nowhere. What signs should parents look out for at that point to really say, my child is not well, my child needs a doctor, I need to do something now?
First of all, I always say as a doctor, as a pediatrician, that parents know their children more than the doctors. All right. So I say to mother, look, I'm just making a child. There's no way I can claim to know your child more than you do. Like you've been with your child for 1 year, 2 years, depending on how old that child is. So parents know when things are different. All right. So there's what we call a safety netting. So you are telling a mother, okay, I'm sending you home. If you notice this, please, or anything that is unusual, bring your child. So common ones are things like seizure, abnormal movement. So if the child is shaking and not shaking, children should not be shaking. All right. They are jerking, their hands are leg or their eyes are rolling. All of these are cool. It could be seizure. So if that's the case, of course, you need to know. Don't be scared. Put the child on the left position, in a recovery position, and of course start counting and call a doctor or strap. If there's ambulance, call an ambulance. If not, start preparing, because if the seizure is lasting more than 5 minutes, then the chances that it's not going to stop on its own. It will need medication to stop. The other thing are things like fever. Now, we talked about not giving antibiotic fever, but yes, in some places, virus is a cause of fever, but in some other places like Nigeria, the common cause of fever is malaria. So if there's fever, you need to seek help, go to the hospital, or, call your family doctor, and then take the child to the hospital, wherever, for someone to examine the child, because they need to check everything to make sure that it is not the kind of fever that needs antibiotics or anti-malaria. If the child is losing to having wateries to much more than the child can take, usually children pass to maybe like 40 minutes, small amount of stool a day, but when they are having diarrhea, it's like times three of that. So that means they are losing more than they can take. Now, if you don't seek help, that child may end up becoming short of water in the body, because it can easily get short of water, what we call dehydration, and that can affect the child, even lead to death. All right. If the child is losing weight, you need to seek help. If the child has a rash that is not disappearing, so even rash at all, you should seek help. But especially if it's not disappearing, that means that there's bleeding under the skin. Because when you press it, there's what we call glass test. So you should press maybe a clear glass of wine, sort of, you press it on the skin. If that rash does not disappear, it means that there's a bleeding under the skin, most likely, and that needs to be, a doctor, or the hospital. That child needs to be taken to the hospital as soon as possible. Um, if the child is not weeing, passing urine, that is a problem. And of course, every other thing, if there's a bleeding, I know that sometimes parents, if they notice bleeding, they will seek help. So they don't need to be told that. So any other thing that is unusual, maybe a child who used to play very well suddenly is no longer playing, then there's a problem. Okay, then you need to seek help. We can say there are a lot of things, but I know that parents will often know our children more than we do. And we know that, okay, this is not my child. This is not how he or she will normally behave.
Yeah, thank you very much. You went far and wide to explain this, and I believe our viewers tonight and those who will be watching this video subsequently will take these cues and be able to draw the line when their child or their children are nowhere and bring them to the hospital. Thank you once again. I really appreciate you for coming to this program tonight. Before we call it a day, what are your last words for our parents out there? What's your general advice for them?
We started by saying that I believe, or my desire, is that no parents should suffer the loss of a child.
Mhm.
And children they have full of potentials, right? There's a lot of dreams, in your children. One could become the president that would change the course of the nation. One could
Yeah.
become um
Footballer.
so, yeah, so whatever, yes. And
Yeah.
every child has a purpose, and they cannot maximize the potential if they are always sick. Okay,
Yeah.
if they're going to the hospital, and taking care of these children begin even from pregnancy, even before pregnancy, where a mother need to begin to plan and make sure that she is immunized, has all the immunizations, and went for antenatal and all of everything that needs to be done for the mother. And of course, after pregnancy, during pregnancy, proper checkup after delivery, adequate nutrition like breastfeeding, immunization. All of these will help your child to be less sick compared to other children. All right, and it's important. So you are trying to protect the future of your child, and
Yeah.
that prevention is better than cure. Okay, and cheaper.
Exactly.
It is cheaper to prevent, than to try to solve the problem. Right.
So
So, and also say that learn to, communicate and seek help early. Whenever you have any challenge, ask questions. It's important. Don't be scared when you come to the hospital. Look at the doctor's eye and say, "I don't understand what is going on with my child." Or if the doctor is sending you home and you don't think it's right, ask questions. If you think if the doctor is if you're not getting headway, seek a second opinion, because you cannot replace with that one child that you have due to carelessness.
thank you. Thank you very much for your words of advice. It's really just last like quite emotional one. I hope all our viewers and those who still listen to this video, none of us will lose our children. They will be healthy, they will be strong, and they will achieve their full potential. Amen.
And thank you for
They
advice.
are thanking you on the chat box. Dr. Guava is thanking you. Dr. Jennifer is thanking you.
Thank
We
you.
really
Thank you.
appreciate you for coming to this live session. You are our true MVP. Thank you, Dr. Promise. And I want to say a very big thank you to my mom. She's always joining my live sessions.
Oh,
And
good
yeah, she's
evening, good
there.
evening,
Her name
mommy.
is Joy Oko. She's there.
I see fit. Oh, good evening, mommy. Thank you very much.
Yeah, she's always there to
You have
support
a
me. And my husband, thank you very much, everyone that came on this live. I really appreciate you, Dr. Jennifer, every one of you. You guys have been a great pillar, a great support system, and has helped me push this platform, Top Child's Health with Dr. Kumerita. I do not take your support for granted. Thank you very much. God bless you all. Have a fantastic night. And don't stop telling people to follow Top Child's Health with Dr. Kumerita for their child's health tip. Thank you and have
all
a
right.
good night. Bye.
Bye.